Imagine waking up with a terrible fever. Your body is burning. Your head feels like it's about to explode. You can barely stand. So naturally, you call a doctor. Good news, a doctor actually arrives. Bad news, he takes one look at you and decides the best way to save your life is to cut you open and drain your blood. Welcome to medieval medicine, a time when doctors believed that bleeding could cure almost anything. Headaches? Bleed the patient. A cold? Bleed the patient. Broken leg? Believe it or not, bleed the patient. And somehow, this wasn't even the strangest treatment they had. For hundreds of years, becoming sick wasn't just dangerous because of the disease, it was dangerous because of the doctor. Today, we think of doctors as highly trained professionals who study the human body for years before treating patients. In the Middle Ages, things worked a little differently. Some physicians were genuinely educated. They studied ancient medical texts, learned about anatomy, at least what little was known, and served kings and nobles. But most ordinary people never met those doctors. Instead, they visited someone much cheaper, the village barber. Yes, the same person who cut your hair was also expected to pull your teeth, stitch your wounds, amputate your arm, and occasionally save your life. If that sounds like a conflict of interest, you're not alone. Barber-surgeons became common because surgery was considered dirty work. University-trained physicians often believed cutting into the body was beneath them. Their job was to diagnose illnesses, read old books, and give advice. Actually touching the patient, that was someone else's problem. So while one man stood beside your bed, explaining why your illness was caused by an imbalance of mysterious body fluids, another man was sharpening a saw. And somehow, these two were considered part of the same healthcare system. To understand why medieval medicine was so strange, we have to forget almost everything we know today. People didn't know bacteria existed. They had never seen a virus. Nobody understood germs. Even washing hands before surgery wasn't common practice. Instead, medicine revolved around a theory created nearly 2,000 years earlier, the theory of the four humors. According to this idea, every human body contained four important fluids: blood, yellow bile, black bile, and phlegm. As long as these stayed perfectly balanced, you remained healthy. But if one became too strong, you became sick. It sounded logical. The problem was, there was absolutely no scientific evidence that it was true. Yet, this single idea influenced medicine across Europe for centuries, which explains why doctors were obsessed with removing blood. They believed too much blood made people feverish, aggressive, or unhealthy. So they reached for one of the most famous medical tools in history, the lancet. A small blade, simple, sharp, and terrifying. Sometimes doctors cut a vein directly. Other times, they preferred something even stranger, leeches. Thousands upon thousands of hungry little worms were placed onto patients because people believed they could restore balance to the body. Imagine paying someone to put worms on you and calling that healthcare. Oddly enough, leeches weren't completely useless. Modern medicine still uses specially raised medicinal leeches in certain rare surgeries to improve blood flow. Not because of the four humors, but because science eventually discovered they produce natural anticoagulants. It's one of the few medieval treatments that accidentally turned out to have a real medical use. Unfortunately, most of the others weren't nearly as lucky.